I think what happens is a lot of people, they'll get their lab work and their doctor doesn't really go over it. They're just kind of
Right.
glancing at it. They're not really paying a whole lot of attention to. They'll give it to you, and they may glance over, and there's some things that they miss. And one of the things, like even Dr. Deborah said when she was here last week, they told her that she had something else, and then when Dr. Jones looked at her labs, it was something totally different. And
Right.
so it's there a lot of physicians are practicing, but you really want somebody that is going to take the time and look at your labs, not only look at your labs, but make recommendations on how you can live an optimal life. That's why Dr. Jones does what she does, is because a lot of us are overlooked. Let's keep it real, Black people. A high percentage of us, when we don't have Black physicians, when we don't have people that care about us, we end up getting sicker. We end up dying earlier. There are things that we could prevent. And her whole goal, the reason why she does this, because I know, because I've talked to her, I've done it. The reason why she does this is because she wants us to live longer and healthier lives. Because what she understands is there's a problem. She has the solution. The problem is that a lot of people are not healthy. They're getting diseases. They're getting cancer at high rates. They're going to the doctor. They're not getting treated properly. Her solution is, let me look at your labs. Let me look at all of your information. I'm going to go through them, and I'm going to give you a comprehensive assessment of your labs. And then wherever you are in the country, I'm going to recommend somebody for you to go to that I trust, that I personally vetted, that's going to be able to give you the care that you need. That's what she does. So it's more than just her looking at your labs. It's more than just your doctor looking at your labs, but you have somebody who really cares about what it is that you're doing. So that's why I love it. That's why I go to her. Just like Kundro said, we definitely need more Black physicians. We don't have them in California. I never had a Black doctor in California. Now, y'all, my doctor is Black, my dentist is Black, my OB is Black, everybody Black. I love it. I'm so happy that I'm finally able to be somewhere and I have a physician that looks like me. That was dope. Like, I'd never been to a place where there was an Ebony magazine on the counter, on the coffee table. What? Ebony magazine on the coffee table? Where are we at? They're not playing light rock. It felt like home. And, so to have people that really look out for you and take care of you, that look like you, is essential. And with everything that's going on politically, with them trying to cut off student loans, and less Black people are going to be able to afford to go to medical school, and all of those things, is really essential that we really kind of try to build our own and support our own. That's why Dr. Jones is here. So it is refreshing, Kundro. I don't even want to go back to visit, I promise you. Sacramento. Oh, you in Sacramento? I didn't know you was in Sacramento. And oh, by the way, Kundro, I got some folks in Seven Trees too. I used to live in Seven Trees, by the way. I know Black people still lived over there. Real TV said I had 2 Black doctors in my family. Ooh, you know what? I married into a family that had Black doctors. That was pretty cool, because my family came from a bunch of sharecroppers, so we ain't had nothing like that. So anyway, Dr. Jones, we're going to get out of here, and I know you got to get your ass to work. But here, let me ask you this.